So in this podcast, we're going to continue with the theme of weight loss. So we're going to talk about Saxenda, which is also known as Liraglutide. So Saxenda is really interesting. It's a really interesting drug. It's a medication that I first came across when I was working in emergency medicine. I had a nurse with me who would actually provide this as a private weight loss solution at the time. Now, the medication that we're talking about here is Liraglutide, and the Saxenda is its trade name. But what I would like you to consider for this question is what the mechanism of action is for Liraglutide and what the licensed indications for Saxenda are in the UK. So let's start with what Liraglutide is. So Liraglutide is a glucagon-like peptide 1 analog, and it's often known by two trade names. The one that we're probably more familiar with as GPs is Victoza, which is licensed for the use in type 2 diabetes, and the one that we're talking about here is Saxenda. Now, Saxenda, on the other hand, is for weight loss rather than type 2 diabetes. So GLP-1 receptor analogues, of which there are many that are present around the world, they activate the GLP-1 receptor to increase insulin secretion, suppress glucagon secretion, and they also slow gastric emptying. So that's how they also contribute to weight loss as well. Now, there's a wealth of information on GLP-1 receptor analogues in the BNF, so I would definitely check that out. Now, the interesting thing with Saxenda is it is a black triangle drug, which is important to know for your administration section, which means in most areas, if not all areas, it's under very strict monitoring rules, and generally it's not recommended for use unless it's initiated by specialist weight loss services. So it's not something that you would be routinely prescribing as a GP. However, it's still helpful to know about, especially when patients may have it commissioned privately, which is where things can get a little bit tricky. So let's consider when can it actually be licensed. So Saxenda, according to the BNF, is licensed as an adjunct to the reduced calorie diet and increased physical activity for weight management in patients who have an initial BMI of greater than 30 or equal to 30, or if they have a BMI which is between 27 and 30, but as long as they have the presence of at least one weight-related comorbidity. So we've considered this already in previous scenarios. So this is your kind of dysglycemia, so your pre-diabetes or type 2 diabetes, hypertension, dyslipidemia, and another one that we didn't mention earlier was obstructive sleep apnea as well. And similarly to Orlistat, the treatment should be discontinued after a 12-week period if the patient has not lost at least 5% of their initial body weight. So I hope you found this helpful. If you're liking these scenarios and you find that our questions are tricky and they're testing your application, which they should do, then do check out the Best AKT mock course, which is offered by wellmedic.co.uk. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.